Hi, everybody. Good evening. Good evening. Well, thank you so much for coming. Thank you for coming to this last Neighborhood Health Series before we go on our summer break. But we will be back in September, and we'll also be back in September with a Zoom option. If anybody is interested in coming and they can't make it here, they can always dial in by Zoom. So we are recording tonight's presentation, and that will be posted to the speakers.roseman.edu website, where you can see all of the past presentations. So just know that. And if you could silence your phones, we would really appreciate that. And we will take questions at the end for our presenter. That helps us get through all the content. And we've got some fun learning opportunities today through Dr. Day. So again, it's so nice to see you. And also I see some new faces. There's some people that I've not seen before here. And so we welcome you. This is a community-based series, free to our community, covering a range of healthcare topics. So we're very grateful you're here. And real quick, I wanted to introduce you to Craig Fraley, who's our sponsor from Clark County Credit Union. Without him and them, we would not be here doing what we're doing today. So here he is.
Thank you, Vanessa. A lot of you have already heard this before from me, and we're very proud to sponsor this Neighborhood Health Series. We are the Medical Field Credit Union. With that said, anybody can join. So if you have an allergic reaction to banks, we're the cure. We're owned by our members. We are not for profit. Every decision we make is for the benefit of our membership. There's a few magazines out there. Also, when you join, there's another card that says Magic on it. That's a promotion card. If you want to join, use that code, and we put in the first $50 into your account. So all the information's out there. Have a wonderful evening, everybody, and thank you very much.
Thank you. We also have some flyers here, and I also wanted to introduce Richard Davis, who's up here, and he is going to be here afterwards to talk to you. If anybody has any questions about Medicare, he is there, and he comes from a Medicare call lab environment where they are able to answer any questions anyone has on their Medicare or considering enrolling for Medicare. So with that, I'd like to introduce our wonderful presenter. Dr. Surajit Dey is currently a professor of pharmaceutical sciences in our College of Pharmacy at Roseman University. He completed his pharmacy degree in India, followed by his doctorate in pharmaceutics and pharmacokinetics from the University of Missouri in Kansas City. He currently teaches biopharmaceutics and pharmacokinetics to first-year students, clinical immunology and ophthalmology in the second-year students, and several research and didactic electives to the third-year students. He also teaches oral infections to the second-year residents in our AEODO program, which is a residency certificate program in the College of Dental Medicine. He has served as the president of Roseman University's Faculty Senate since 2012 as a liaison between faculty and our university administration. He is very active at a national level in various professional pharmacy organizations, promoting the profession of pharmacy. He is the current chair of the Global Education Special Interest Group at the American Association of Colleges of Pharmacy. He's also an editorial board member for the American Journal of Pharmaceutical Education and an academic leadership fellow of AACP since 2015. He has published extensively about ocular drug research and is currently engaged in understanding and treating various sight-threatening diseases such as chronic dry eyes and age-related macular degeneration. Please join me in welcoming Dr. Dey.
All right, can everyone hear me okay? Perfect. Thank you, Vanessa, and thank you to our sponsors for this program. I'm very glad to be here speaking to you about a topic that I'm very passionate about. I've done research on this for a couple of decades now, and I'll try to introduce this, and then basically, as I said, as Vanessa mentioned, that if you have any questions, we can answer those questions. So together, we will go through this, about our eye health. So often we don't think about eyes as a very vital organ. And in the sun here, and as well as in other conditions, as we age, obviously it deteriorates. So we're going to be talking about how to protect them, how to maintain vision. But before I do, I'm just going to go and talk a little bit about there you go. So some outcomes for today, and talk about the common diseases, disorders, how it changes as we age, learn more about the aging process and how to identify certain lifestyle practices that promote better vision. So our eyes, right? These are our connection to the outside world, obviously. And our eyes, just to let you know, that it has evolved over hundreds of millions of years, 550 million years. That's a long time. And almost all animals and mammalian species, birds, all of that, they have eyes, though all are different than from our own human eyes. They're obviously organs of vision. And did you know that this visionary pathway is super important for our memory formation as well, right? So essentially, 80% of our memory are visionary memory. And the other 20% are other senses like hearing and taste and other stuff. But most of our memory formation is with visionary pathway. So it's a complex process. It's a very complex optical process. It collects light, it focuses light, it forms an image like a camera, though very different. But these images are converted into different signals. And the brain is what does all of these in a very complex neural pathway to interpret what you see. So the way you can see me today is light from these lights, ambient light is falling on me, reflecting, going into your eyes, going inside, and the cells are doing all the magic, and they are getting excited, and they are sending signals back to the brain that this is the image. And that happens super fast, very, very fast, microseconds, actually, super, super fast. And most of our animal species possess a very complex system. Now, if you look at evolution, we know that our eyes are complex, but there are other complex eyes as well. And some animal species and other species have lost even vision if they don't need it. Like think about animals that live in caves, for example. Like they live in perpetual darkness. They do not need the eye. And there are some salamanders and stuff like that live in specific cave dwellings that have had eyes, we know, and have lost the vision as well because they don't need it. So very, very fascinating, this evolutionary process that we have had. Also, did you know that newborns don't produce tears? Their tear glands do not form quite till about 4 weeks old. So if they're crying, you'll see they're crying, but they're not producing any kind of watery fluid. So typically speaking, our eyes can be divided into maybe 4 to 5 major organs or organelles within. Your outer layer is your cornea. Everyone heard about cornea, right? Conjunctiva. So that's a transparent layer as well. So if you've probably heard about conjunctivitis, maybe if you ever had infection, red eyes or pink eye, that's what it gets inflamed. The lens is inside. So I don't know if anyone has had or know of anyone that have had cataract or cataract surgery. That's the lens that gets replaced. Your coloring of the eyes are coming from an organ called iris, which is behind the cornea. And then the main photoreceptor, meaning the visionary organ, is your retina. That's in the back of the eye. Now, we almost are, if you're looking at someone, you can see only about a fifth to a sixth portion of the eye. Everything else is inside, which we can't really see. So it's kind of hidden in your socket of the skull. And there are muscles and other blood vessels that provide nourishment and support to the eye as well. And then looking at all of these, a couple of important, I guess, facts and factoids. Your eyes are a super healing organ, meaning your eyes heal very, very fast. Constantly, we are looking at it, we're looking at things and dust particles, especially in the desert like here, when you have hot dust, hot winds and dust that are going, the cornea can get scratched up, but it's healing super quickly. Within a matter of hours, it'll heal. A deep scratch will probably take only about a couple of days to heal. So it's a very, very fast healing organ. And everyone probably seen like in movies and stuff like that, like, you do the retinal scan and, spy movies and stuff. So your iris actually, the light goes through this and your retina is as unique as a fingerprint. Actually, it's got probably more ways to map the retina. So a fingerprint, that's just like a fingerprint, has about 40 unique characteristics, bumps and little things and dimples and stuff like that. Your retina actually has about 256. So it's a lot more. So very, very specific. So it can be used actually, to provide security. And that's your retina, which is the visionary organ. If you can see these little cells that look like Christmas lights, they are what actually gives color vision, so that we can see vividly colored vision. And these are little rods and cones. Cones are the ones that look like the Christmas lights. And can anyone tell me how many colors can we independently distinguish? Any idea? A lot. Yes, definitely a lot. Quite a lot, believe it or not. We have some primary colors, but there are so many different colors that form. I mean, I guess in this room, we can probably have 5,000 different colors that are here, right? So human eyes can distinguish anywhere between about 10 to about 1 to about 10 million. Yeah, a lot. And you'd think that that's probably the most, right? No. There are other species that can actually distinguish a lot more than that. 1 to about 10 million. 1 million to about 10 million. Yeah, so a lot of colors. We can see colored vision vividly, but then we also, evolutionary-wise, we have lost other senses in the eye. These rods that you see that are not colored, they're used for night vision for the most part. And predatory animals, you can think about large cats, like lions and tigers and stuff like that. They have a lot more rods than we do. So they can see very well in the dark, which we can't. We kind of traded our color with an ability to see in dark conditions. So if you have a question about whether, just like other organs, your eyes can be transplanted or not, the answer is no. Eyes cannot be transplanted as a whole. It's just too complex. There are more than 1 million nerve fibers that go from each eye to the brain. It's impossible to connect all those. Like you've heard about heart transplants and lung transplants and kidney transplants, very common. But an eye has never been transplanted. It's just impossible to reconnect those neural pathways into the eye. There are some artificial eyes that are coming, but those are not really a transplant. They are like camera-like stuff that gets attached to a sensor get attached to the brain, which can interpret kind of thing, can give you a fuzzy image. So think about somebody who is losing vision rapidly. They can still maintain some sort of a vision, but not quite what we see. The best camera on this planet cannot match the quality of what you can see with your eyes. So.
Going back to 1 to 10 million, that means some people can see 1 million and it varies from 1 million all the way to 10.
Yeah, so.
Depends how, depends on genetics of the person.
Yeah. I mean, it's kind of estimated that depending on the number of colored cells that we have, depending on that, you'd be able to see somewhere in that. Not all of our visions are exactly the same. So some people can see, and we'll talk later today about, if somebody has, color blindness as well. So that's the thing that we'll talk about. So that's what we are talking about, that a lot, like mammalians. So we have some butterflies and pigeons, about 10 billion. So humans up to 10 million. Honeybees, some apes, most apes, reptilian, amphibians, birds, and insects can even see more than us. And believe it or not, your common pigeon can see up to 10 billion colors. Fascinating, right? And it's all to do with the cone cells that's there. And think about an animal that lives in deep sea, a whale. I mean, they don't eat. It's almost always dark and gray in color. They probably see shades of gray, but never quite the color. And dogs, they also don't see color very well. So they also see different shades of dark and light and gray and stuff like that. And essentially, the color formation and all that stuff is all genetically controlled quite a lot. So it's very complex because there are multiple genes that actually does this. We know we can actually map out the rods and cones, but it's so fascinating that there are some animals and some mammals that can see more than us, like more color than us, shouldn't say more than us. So talking about color blindness, the next part. Can everyone see this little dot thing and see what number is represented there? All right, very good, 74. So you can all see that. So this is red-green coloration, really. You cannot see? All right, so there are different types of color blindnesses. And this is red-green. So you can actually see this different shades of red and different shades of green there. There is also blue coloration. So it's different cones that map that. So it's a test that if you ever go to an ophthalmologist or optometrist, and if you're testing for color blindness, they'll actually give you a bunch of these numbers in these pattern of numbers within these, and they'll ask you to see if you can see them or if you can read those numbers. So that's really color blindness, and it's a very common phenomenon. But I also want to talk about the picture that you see at the bottom of that. What do you notice there? Yeah, two different color irises, right? You can see one of them is like more bluish and the other is more greenish. That's a condition that is also, and it's a condition, not a disease, because it's less common, but it happens, and it's called heterochromia. And we know it's because of different, essentially, genes that code it. Normally, always we have the same color for both, whether it's black or dark brown or brown, light brown, hazel, blue, green, whatever. But heterochromic eyes have different colors. Some of people have very starkly different colors as well. Very common in dogs and cats. If you have a pet, you'll see that they have light colors and sometimes two different eyes. But in humans, it's less common. Again, a condition is very innocuous. Yes?
Does the color of the iris have anything to do with it?
No, not at all. The color of the iris is coded very differently. It has nothing to do with vision. So yeah, no. They can see exactly, probably they can see exactly the same as anyone else with two same colored eyes can see. So this color blindness is mostly inherited. And it's about incidence of about 1 in 12 men and about 1 in 200 women. And this color test I was talking about is the Ishihara color test. So if you're thinking about, people know, and has everyone noticed that when you're driving, the traffic lights are always in the same order of red, green, and yellow? And it's because of a lot of this, right? So if people don't know the color, they would not know where to stop or what is. So it's always, they can at least see things changing. Huh? So moving on, you may be wondering, like, okay, so your eyes are your window to the outside worlds. How are they protected? How do we protect it? How do we keep our vision, maintain our vision? So one of the primary thing is tear fluid. Yeah. So a lot of my work actually goes in understanding of formation of tear, believe it or not, and we'll talk more about that. But they are secreted by some glands that are present all around it. And a tear is actually, think about it as a sandwich that you're eating right now. It's a 3-layer thing. There's a layer of oil on top, there's a layer of water in between, and a layer of a sticky substance called mucin underneath. So there are different functional reasons why we have that, because the sticky substance, we are always standing up like this. So if you did not have anything sticky to hold it, they would constantly drain downwards, right? And it'll be drier. So, and the oil stuff that's there actually is there to prevent evaporation so that it doesn't dry out super fast. And what do we do all the time? Like just in this moment that I'm talking, you probably blinked 5 times. We constantly blink, and that gives a nice, fresh, new coat of tear. Every time we blink, we renew this. And tear is not only for, forming this moisture layer, but it's also for protection because it contains stuff that actually helps in prevention of infections. We are constantly being bombarded with like bacteria and viruses and other particles that are hitting us. So that is protection and lubrication. Does anyone here have like dry eyes or dry eye symptoms? All right, so if you have that, it can feel chappy, and we can talk more about it. There's a lot of new advancement that are happening and very fascinating time to be looking at dry eyes now, but we'll talk more about it later on. All right, so who can tell me how many substances do you think are present in your tear? 1,500. You are absolutely correct. So we actually have a slightly over 1,500 different proteins that are present in the eye. They function differently, but the whole function is protection, lubrication, those two main things. Yeah, there's a lot. I don't know who found out. Like they probably went and found out every single protein. And it's like 1,500 different ones. But we are glad to have these. And this blinking thing is also pretty common and unique to us. For example, there are animals that don't blink as much as we do. A rabbit blinks like 3 times a minute, where we blink like 20 times a minute. So these blinking rates are also different for other animals. So what are some of the common eye disorders that you have heard about? So everyone heard about red eye, pink eye? So it is mostly, a lot of this time, is anyone getting these red eyes as the climate changes from cold to a little warmer and then spring? Yes, allergy, right? Allergy is pretty common in this in the city. I suffer from sometimes eye allergy. They feel like scratchy and like watering. But it could also be because of infection. So conjunctivitis could be bacterial as well, but for the most part, it's non-infectious allergy, simple. Dry eye, we'll talk about floaters. I think that's a common question that comes up, like what is a floater? I see something floating around. How can I get rid of it, right? And then refractive errors, which are basically stuff like nearsightedness, so something that you can't see far or can't see closer. Or you could have astigmatism, which means really you don't see clearly on one angle, but see clearly on the other angle. So all these are corrected. These are called refractive errors. All these can be corrected with glasses. And I see many of you actually wearing glasses or contacts, perhaps. If you see my eyes, I do wear contacts, and I use a daily contact that I use it once a day and throw it. We can talk more about best use of contacts and how we can protect any kind of infection that come out of contacts, like abusing contact lenses. But these refractive errors are all treatable with glasses or contact lenses. So the red eye, pink eye conjunctivitis is very common. As I said, allergy. Less common would be bacterial. I remember, I think once or twice in my entire life that I've actually had an eye infection that needed like antibiotic eye drops. But allergy, you can have it anytime. Some of us suffer from perennial allergy, which means allergy throughout the year. Some of us suffer from seasonal allergy, which means when the flowers bloom and stuff like that, like once in a season. And some of you may have allergy that are related to specific things like dust, like pollen. You pet a cat or you pet an animal and you have animal dander allergy. So these are common allergies. A lot of us take anti-allergy medications, and you are just fine. So one of the signs of a bacterial infection would be this discharge. Things that come out of the eyes are thick and sticky. And that also leads to eyes stuck shut in the morning. So in the morning when you wake up, you just can't open it. So what do? You take warm water and try to flush it out, right? It's called eyelid crusting as well. You take over-the-counter antihistamines or allergy eye drops or Saturday, which is now over-the-counter as well, or antibiotic ointments. But I would say protection is better than cure. So how do I protect my eyes from getting these? Washing your hands, not touching your eyes with your hands which are not washed. antibacterial wipes and stuff like that. All of these help. Every time I'm actually traveling, which I'm actually going tomorrow to see my niece graduating high school. So, and every time I will get off the plane, I have an antibacterial wipe, and I'll just wipe my hands and stuff like that, just because we touch our face and our eyes all the time. So just as a common protection. So dry eye disease, and I asked this question earlier, like how many of you actually have any kind of symptoms of dry eyes? It's not always detected very well. And it's common. We anticipate about 30 million, so 10% of our population in the United States actually have dry eyes. Not diagnosed, but they could be diagnosed. It's really two reasons why we have this. Either the quality of the tear is poor, or there is not enough tear. So your eyes are not producing enough water or tear. It manifests in sensation of something stuck, or a burning sensation, eye redness. It is seen as we age also, so the tear ducts or tear glands also change. It's predominantly in women. And all of us have cell phones, watch TVs, look at everything on a phone or a tablet. And our kids are on the phone all the time, like TikTok and Instagram, all of that stuff. So prolonged screen time, TV, cell phone, tablet. Also, it can happen if somebody underwent some kind of surgery like LASIK. Not enough sleep, and I see that a lot in our pharmacy students and other students. Like they're constantly, like on the assessment day, you can tell that these guys have not slept. They're probably going on like 3 hours of sleep. And the dry eye disease market from a medication standpoint is a large market. It's estimated to be about 7.7 billion. That's how much people would spend on buying medications over the counter or prescription by this time. So it's a big market from a standpoint of drug development, from a standpoint of the business aspect of it as well. So how do you manage dry eye? So I would say check your medication, talk to your doctor to see if prescription might be causing any dry eye. So there are medications that cause. Eating healthy, nutrition helps a lot. Pollution and irritants, that also can cause that. Hormonal balances, whole grain, eating more whole grains, less sugar, few processed food. So some of the dietary restriction can change your hormonal balances as well. Contact lenses, using artificial tears, and these are over-the-counter little eye drops that you can put just to lubricate, feel a little bit better. It sometimes works, sometimes doesn't work. Hydration, in this, we live in a desert climate, which we forget that we need to drink a lot of water for it. And then finally, blink every 5 seconds or so. And normally we just blink anyway, but it can also happen. Sometimes you'll see if you have not done the blinking and you're looking at a computer, it feels like fuzzy and hazy because it's drying up. Sure. Mm-hmm.
They actually blink more.
Need to hydrate. When they lie down?
No, when they lie.
Oh, when they're lying. Oh, you mean a lie detector test type of thing? Oh, yeah, for sure. I think the question is when you lie, tell a lie, when you're lying, you tend to blink more. So I don't know the answer to that question, like why lying? I guess it's psychological. It's like the fear of being caught. But there are other people who have probably have taken that test and lied, and then the machine couldn't catch it. I don't know. I think you're right. I think it's possible, but it's probably the psychological fear of being caught. So there are some devices, and again, your ophthalmologist will be able to tell you a lot more about these, but there are devices these days which can actually help. Some of them are at-home therapy. Some of them are inpatient at a clinic. These are more on the expensive side. I think these are about $500 to $700 per treatment type of thing. The at-home therapy is obviously a little cheaper. And then there's a newer one which basically is a stimulatory organ. They actually tickle the nose. Believe it or not, if you tickle the nose, your eyes will water up. So when you sneeze, you feel like your eyes are also watering, right? And that's the reason. So somebody found this great idea, and actually it's now FDA approved that tickling the nose or stimulating the nerve endings in the nose can actually cause more tear to form. So, but there are many eye drops. Lubricating eye drops, which is no medication, so no drug in general, such as Visine, can help. But they will not cause, if you actually have a condition that has been diagnosed as dry eye disease, you need medication therapy for this. And there are, as you can see, that there are many drugs that are currently approved. And if you look at the dates, you'll see that they are approved pretty recently. So the companies are going all out to make these drugs, do a lot of research and development because this is such a large market. And one thing that really exciting these days to know is this new one. I'm not proposing anyone take this. I'm not doing any kind of this thing, but this is so fascinating to me. It's called varenicline. That's the name of the drug. That goes by Tyrvaya, and it's actually a nasal spray. So you increase your tear by a spray in the nose. It's fascinating to me. It's one of the newest one. You may have seen in the TV. It's just about to come out. It's a nasal spray about twice a day. And a lot of people are, like, the most common side effects are just sneezing with any nasal spray. But you can see the pathway. There are nerve endings that go to tear glands and get connected to the nose, get connected to the brain. So when you spray, this varenicline actually can cause the tear glands to produce more tear. This drug, by the way, interestingly, is also used in a different format as a smoking cessation drug to prevent smoking too. So imagine how they have changed this totally, and now we're using for dry eye disease. It is out, but I mean, you have to go to your ophthalmologist and they can prescribe it for you. Yeah, it's just coming out because it was approved only in 21. So it's just about, I think there I see some of the places that this is out, and in some TV ads and stuff, I'm just seeing this come out. So typically when this approved, it takes a few years for it to actually come to the market. But what excites me is, like, it's not an eye drop. It's nothing. So some facts about floaters, right? Anyone has suffered from floaters here before? Anyone has floaters? Okay, so a lot of us, right? So these are little cobwebs of specks that float in our field of vision. These are small, shadowy shapes that looks like spots and kind of annoying, to be honest, right? You can see stuff floating and you're like, how do I get it out? Do I shake my head? Actually, it doesn't happen that way. It occurs because your eyes, another interesting factoid, does not have any bones or cartilages. Not at all. It's like a balloon. It contains two fluids, two liquids, really. One in the front, one in the back. And when one of those liquids shrink a little bit, it causes particles to kind of come out, like crystallize in a way. And those are really floaters. The goal is, over time, it'll actually going to just disintegrate and go away. But in the immediate, like a week or 2 weeks and stuff like that, it's just annoying. It's just always in front. It has also been shown for folks who are more elderly, nearsighted, having diabetes, and have gone through some surgery like cataract surgery, where you actually have to operate and take the lens out. So it's nothing to be afraid of. Floaters is common. It's fairly common, actually. And if you see it, don't want anyone to panic. It supposedly would settle down and go away. Protein deposits, yeah. There are little protein and other particles, but mostly like, fats and proteins, yeah. Sure. I I've never heard. I've never, huh? Yeah, so it's yeah, no, I mean, it contains lubricant, really. It doesn't contain a drug, but yeah, I have not heard. Don't know the answer to that. I would not recommend anyone using it other than prescribed. Sure. Yeah, that could be great. If you could just write it down, and I don't know if you have a piece of paper or something, but I'm kind of halfway through, so we can just go ahead and complete. And then I'm glad to go back each slide if you have any question on a particular slide. So vision and age, right? I mean, as we age, we know that things change, stuff happens, and it essentially is reduced. We get reduced visual acuity. What is acuity, visual acuity? What does it mean? It really means that the ability to distinguish and see that crisp vision that, when we were young, that crispness of vision would go away over time. And this is really changing of different things. As we age, our lens becomes slightly larger. So a few years ago, I think a couple of years ago, I went to my eye doctor. By the way, we'll talk more about this, but I hope everyone goes to their eye doctor on a routine basis. I went to my eye doctor, and I'm like, I wear contacts, but I'm kind of like looking like this. And you're like, how old are you? I'm like, yeah, I'm just like 43. And he was like, yeah, it happens in this age. You're just getting that the near sightedness slowly creeping up. So it's like, we'll change the prescription and add a little thing on your contact. And he said that if you wear contacts, you probably won't even need it. But if you're like reading a menu or something like that, sometimes you adjust. So yeah, so as we age, things just keeps on changing. We lose focus. I think glasses and going to an optometrist definitely helps. And I would just talk about these 4 main diseases of aging, as I call it. Macular degeneration, and if you have never heard about this, we'll talk a little briefly about this, but hopefully everyone heard about cataract and diabetic retinopathy, which is actually happens because of diabetes, which is so common, and glaucoma. These are all age-related eye diseases. Remember, we can age without ever experiencing change in vision, and losing vision is not a normal part of aging. So we want to maintain our vision as much as possible. And I have some, I guess, some statistics which you'll talk about, but these are all from, a lot of the data that I have is all from National Eye Institute, which is part of the National Institutes of Health, which is this large governmental body that has a lot of research going on. It's part of Health and Human Services. So that's where I got all of these from. You can see some of the references back there as well. So how many Americans over 40 have age-related eye disorders? And the number is alarming. Cataract is the largest by far, okay? About 24. This is slightly older. I think it's about 10 years old, but it's about 24 million cataract, about 7.7 million diabetic retinopathy, glaucoma, and then AMD is the smallest slice of the pie, about 2 million or so, a little bit more than 2 million. But this is growing. I have some data, more recent one that I can share. We'll first talk about age-related macular degeneration. Has anyone heard about that term, or AMD for short? Okay, good. There's a new term that you might hear. It's called geographic atrophy, or GA. That might also come up in your vocabulary, because a lot of people are calling a group of macular degeneration as geographic atrophy. As you can see from this, from the data from here, again, I'll try to make it like super, super quick and simple. It's growing, right? 2010, 2030, 2050 projections is showing that it's going to grow to over 5 million. And you can also see that it's also disproportionately more towards the Caucasian population, macular degeneration. Then we know. A lot of these small little graphs, these are African American, Hispanic, and other population. As you can see, this blue graph is all white or Caucasian population. So it's disproportionately high. As I said, cataract, these are the numbers that we have said, about 2 million or so. And this is going to go globally. I want to just kind of put our head around it, wrap our head around it. Globally, now we know in 2020, about 200 million people are affected by AMD, which is supposed to go up and keep on going up. So this is a pretty severe disease state, and it happens in mostly as we age. So the risk factors are greater than 50, mostly in females, mostly in white population, some family history, and lifestyle, smoking, dietary style. So and what happens is that over time, eventually, these are some of the signs and symptoms. I don't want anyone to panic. There are good news on the horizon. So there are treatment options. 20 to 30 years back, there was no, but now we have several different treatment options. So you can see this picture like a normal vision. Somebody who can see these two friends who are playing with soccer balls. And now you can see somebody who would, if somebody had macular degeneration, what would they see? They see like a dark spot in the central vision, which means looking at it and the spot doesn't go away. Street signs can appear blurred. Blind spots can start appearing. Letters can appear jumbled. The letter can appear like I'm showing, it's difficulty distorted. And one another sign is, if you see straight object like the door frame here, they would appear wavy. So those are some of the signs and symptoms of macular degeneration. So think about somebody driving with a black dark spot. It's very debilitating. It's not a good experience. But as I said, if they take medication and follow through the medication, it will slowly get them better. And there are so many now new drugs that are in the horizon. Why does this happen? Is because of, so if you have never seen this, this is actually a picture of your retina, not your retina, but picture of a retina. So on the left, this is actually from Emily Chu, Dr. Chu's lab in the National Eye Institute. And if you see the left picture, that is a healthy retina, a normal retina. You can see this little white spot here. That's the optic nerve head. That's where all the nerves bundle that goes through. You can see the blood vessels underneath the retina, which are healthy here. But I wanted you to see this and this. First of all, the coloration is a little discolored, but that's not the problem. But see what's here in the central area. Seems like there's some hemorrhage that has happened, meaning some blood has leaked from the blood vessel and coagulated, puddled there. So that's one of the problems. And then the other one that you see here, which is geographic atrophy, is you have these little tiny white spots. Can everyone see this? Like this right around here where my cursor is. These tiny white spots, they are also a sign of areas that are just deteriorating for some reasons. And if you ask me this question, do we know when it starts? Do we know how to stop? What causes this? What triggers this? We really don't have answers to that. We don't know what triggers it. But we know that it's age-related for sure. And we know that doing certain things early in life can actually help slow down this process. We know that for a fact. So first of all, can you prevent this? Absolutely. This is not an eye test. I just wanted to show you this letter. But if you go to an eye doctor on a regular comprehensive exam, typically we go, I think, once a year or so. But if you have vision problems and stuff, you may be going more often than that. Typically, low vision problems, you'd probably go maybe twice a year. Just follow-up processes. They'll go through the process of dilating your eye, which means making your pupil a little bit larger so that the physician or the ophthalmologist can peer into it and see whether your retina is healthy or not. Often they will also ask you that, do you want to take a picture of the retina? And it's a good idea to have a picture of the retina once every few years or so, just to give like a benchmark, just to see where there is. They will also measure the pressure of your eye. Does anyone remember this? Going there, sitting there, putting your chin there in a little machine, and a puff of air hits your eye, right? And you're like always blink, and they're measuring the pressure of your eye. And high eye pressure is an indication of a disease called glaucoma, which we'll talk about later on. So everyone, please go to your optometrist or ophthalmologist in a regular interval. So that is definitely something I would recommend to start with. Now, let's say, what percentage do you think gets an annual comprehensive eye exam? Less than 10%? Anyone since greater than 80%? Yeah, I would not bet there either. It's about 45% or so. So close to 50. And I think awareness has improved tremendously. I think I remember my first eye exam. My mom thought I was actually bluffing because I said, "Mom, I can't see." She's like, "No, you want like cool glasses. That's why you are like making this up." And I really couldn't see. Like I was in high school, middle school actually. So prevention is certainly better than cure in this case. So diet and nutrition does help. And that vegetable there, that is a curly kale. If you have not seen that, that's a curly kale, and that actually has high levels of compounds called lutein and zeaxanthin. Spinach also has it, and those are definitely beneficial. We know high fruit diet, high vegetables, especially those dark leafy greens, kale, spinach, Swiss chard, others, I mean, whatever you like, they help to reduce that. Consumption of oily fish also does. Salmon, or most of the ones that are like deep sea fish, you can sardines and salmons. We don't get fresh sardines here though. You got to be in Italy to eat that type of thing, right? But mackerel, yeah, definitely, absolutely. We know vitamin A, C, and E, they do have a protective effect. And there are multiple studies that have shown that we have, including archives of ophthalmology, investigative ophthalmology and visual sciences, that with IOVS, all of this has shown that greater levels of pigmentation actually helps benefits. So all of these, what I'm talking about, that actually helps to maintain the pigments in the eye. And what are these pigments? That's not the coloration though. We actually have pigments in the retina. So if you look at someone's eye, like from the little, pupil, you see it's dark inside, right? I mean, yeah, it's kind of creepy to look up to someone and say, but you know what I'm talking about, right? And the darkness is because of black pigmentation in our retina. And all of these actually help to restore that, keep that. So we know if starting this early actually has a significant, and I'm talking about 25 to 30% reduction in development of advanced macular degeneration. So starting this early is definitely a good thing. And there have been studies that have been done. There are two studies, at least one from the mid-90s and one from about 10 years, a little bit more than 10, 15 years ago. And they said that does daily intake of certain vitamins reduce? And the answer is yes, about 30%, as I said. Again, these are some of the common ones. I'm not prescribing one or the other. But if you go there, you can get eye vitamins. You can go to your pharmacist, ask for that, and they'll point out to the over-the-counter. These are all over-the-counter, non-prescription, and they have this multivitamins for the eye, and that's all beneficial. How much do these cost? How much do these cost? Anyone? Roughly? Okay. So I've seen between like 30, 40, yes, something, depending on what you take. And these are twice a day. So this is like a 2-month supply type of thing. So about like, about $20 to $30 per month, roughly on this. I think it's good. I think definitely if you're in one of those categories or areas where you think that you maybe have a family history of somebody has macular degeneration. So definitely I would start taking these. But there are also drugs, right? There are medications. I'm not going to go into all of these, but I want to kind of talk about some of these in generality, that these are mostly biologics in nature. Biologics are a group of drugs that are fantastic in that they can target very specifically. They're also expensive in nature, right? And they're given via an injection into the eye. And if you're squeamish about this, like somebody's going to poke in my eye, yeah, it's obviously, but these days they're so sophisticated. It's an outpatient procedure in probably an ophthalmologist office. It's a little, almost feels like a little pinch type of thing. Maybe, I don't know. I've never had it done, but I think the choice is where like, oh, I'm going to lose my vision, or I'm going to take an injection once or twice a month. I'll choose that one. But these are all biologic therapy. They're great. I know a personal family friend of ours who has macular degeneration and was losing vision rapidly, and now takes one injection every 6 months or so, and has gotten back the visual acuity, has gotten back able to read properly, see movies, gotten back. I mean, it's getting back vision is getting back life, really, right? I mean, it's a huge thing. So the next thing I want to talk a little bit about, hope I'm not running out of time, but we'll make it quick. I still have time, right? A little bit. Cataract. Cataract is age-related, again. And as you can see that when we are young, it's almost negligible, like 2%, 5%. But when you see someone age 80 plus, about 68%. So definitely age-related, right? And cataract is actually not, it's a condition. It's a painless clouding of your lens. So what you really see is you actually see not very clearly. You see people like hazy. And it's a very easy outpatient process to cut open your eye a little bit, again, under anesthesia, take open the lens, take open your actually God-given lens, which can't make that anymore. So we have a plastic lens that can be put in and slowly sutured in, and probably takes like 15, 20 minutes. My grandmother underwent cataract when she was 89. So she also had a hip replacement when she was like 96, 95. Yeah. So she's still alive. She's 97. I'm going to go and see her over Christmas. So the risk factors, as I said, for cataract is also aging. Certain diseases, so diabetes seems to increase certain risks. So obviously controlling it, taking your blood sugar levels, taking medications if you have it, personal behavior like limiting smoking and alcohol use. And I think one of the biggest thing is in this desert climate that we see is this extreme sun. And that causes havoc and changes. Like you use sunscreen to go out. How are we going to protect the eyes? We need some UV protection, right? Sunglasses, yeah, exactly. So you can get prescription sunglasses. If you get glasses, you can get those transition glasses, UV coated regular glasses, all of that. Cataract surgery is pretty common. I think we can watch this up. We'll watch it later, but it's just basically taking off the lens. Super, super quick. What happens during the surgery? Your eyes are washed, very little time. If you're awake, it's mostly awake. It's never done this thing. So it's just numbed, so you won't even feel anything. And you can go home the same day, but don't drive. You really can't drive. Have somebody, they just patch up the eye a little bit for like a couple of days. What happens after surgery? Mild itching and discomfort is common. You feel like you want to scratch it, and doctor says don't scratch it, so they put a like eye patch. Maybe sensitive to touch. Continue using antibiotics, eye drops, to prevent any infection. Rubbing, pressuring, scratching, all of these things prohibited, and not to lift like heavy objects for a few weeks. So, and this is how, and do you know that other animals like dogs get cataract all the time as well? So you'll see like clouding of the cornea, and you can actually see through them that like this clouding of that, like slight haziness. So as I mentioned before, all of the things that you need to do is to protect yourself. Like Las Vegas and Phoenix have very high UV indexes in the summer, like 10, 11, which are like super high. There's no drugs for prevention of cataract. So surgery is the most common one. So no need to be afraid to or worry about it. It's a very safe and effective process. People go through that all the time. But wearing some sort of a sunglass, a hat, and just preventing any sun direct exposure into the eye, I would say, is to prevent. So we are here, right? 300 plus days of bright sun. It's beautiful most of the time, except when it gets summertime. It's just, I moved here about 19 years ago, and I always say that I think the heat is going to grow on me. I think it has never. So when it's hot, there's no way to slice it. It's just hot. So sunglasses is a must. And make sure that the main 3 rays just for sunscreen as well, like UVA, UVB, and UVC, and everybody should protect the eyes. So funny thing or a strange factoid here, you'll see in the US, cataract is common, but not as common in other developing countries. For example, places in Asia. And the thing is, some places where it's more clear, so more polluted areas will see less cataract because the sun can't penetrate through. But if you go up in the mountains in those areas where there's more, than people have more cataract. Yeah. For diabetic eye disorders, we have about 7.7 million people have diabetic retinopathy. It is one of the leading cause of vision loss and blindness, and it's preventable by managing a lifestyle that is healthy, managing diabetes, early detection, and follow-up and treatment. So basically, diabetes, what it does is really it damages blood vessels in the back of the eye. And you can see the same picture of these 2 friends playing soccer, and a patient with diabetic retinopathy will see like black spots right in the middle, right there. Is it like that for everyone? No, it just progresses to bad, and eventually they won't be able to see. So I would say early onset can be always arrested by proper drugs. It's just controlling your blood sugar levels. So we call something called a TRACK, T-R-A-C-K. So take your medication, reach and maintain a healthy weight, physical activity, A for activity, C for controlling your ABCs, which are A1C level, again for diabetes, B is for blood pressure, and C is for cholesterol, ABCs. And then kick the smoking habit. So remember TRACK it is. And I'm almost ending, so we'll just complete. So glaucoma, again, a silent sight-threatening disease. A lot of people don't know they have glaucoma. And when they go there, they already have it. Again, super treatable, not a problem. Just eye drops is, and these are some of the common eye drops. If you are glaucomic, if you take it, you've probably heard about this drug called Xalatan. It's very, very common, but there are so many more. I think there are like 50 drugs for glaucoma to treat these days. I've been asked in the past about LASIK surgery, like, hey, can I take LASIK? Can you do? Absolutely. If you think your ophthalmologist actually wants you to go through, not everyone will be a LASIK candidate. All they do is basically cut a small flap in the eye and then just correct your vision so that you do not need glasses. And the cornea is just allowed to heal normally. I said about 2,000 per eye, but it's actually a little bit more than that. Don't go anywhere where it says like get one eye and get one eye free. Don't go there. Don't go any place that does that. Make sure you do your research. Make sure you talk to your ophthalmologist or talk to somebody and go to the best surgeon possible. And initially, if somebody gets LASIK, it doesn't improve immediately, but over time, it'll be better and better. So if anyone is thinking about it, I would say definitely explore. Definitely explore. You may be a candidate for it. And it's just like how laser kind of burns a little bit holes on it to correct vision. Yeah. I don't know how long this thing lasts, but it's probably not that long. So it's just all laser guided therapy. It's basically, it's just burning a little bit to correct your vision so that you can see crisp. Yeah. Overall, successful, very successful. We have about almost 99% patient satisfaction, and greater than 99% says that they can see better than 20/40. Some folks do see some adverse effects. There have been studies that have found that a lot of people have found at least one visual problem. But to your question about how long does it last, I think eventually when our eyes change, so let's say if you are very young and as we age, as we know, our eye modifies and changes, I would say that, yes, you may have to go and get corrective vision afterwards. Maybe that would be glasses or a secondary surgery. But typically, I've heard people that have had LASIKs in their 30s and they are just fine. They're like 50-year-old now and they're just fine. So I think it varies, but it's a very high success rate. A lot of people get LASIK all the time. And most commonly, people say that they have some dry eye symptoms, have an itching type of thing, something, but most of this patient satisfaction is very, very high, I would say. Yeah. And it's super, I would say, approachable these days. Like, there are a lot of physicians who are doing, a lot of ophthalmologists who are doing this. They're trained in LASIK. So if you can see this, so essentially we're talking about age relation and what causes low vision, what are some of the numbers, what can you do, as I've talked about, talk to your specialist, food, diet, activity, the TRACK program that we've been talking about. So by about 65, 1 in 3 Americans will have vision impairing disease. Do not hesitate to go to your eye care professional, getting your eye exam, talking to your doctor, getting your, tell them if your PCP have found out any kind of other assorted, other diseases, maybe diabetes, cholesterol, blood pressure, all of that stuff. Definitely wearing sunglasses. Definitely if you're wearing glasses, you can have UV protected glasses. Those coating on top, even if you're working on a computer or watching a tablet or something, those help. And I can't emphasize, and maintaining an active lifestyle for the length of it helps a lot. Whether it's mild and moderate, I think the new American Heart Guidelines says about 150 minutes a week. So about like 30 minutes a day or something like that. Whether it's like just walking, rapid walk, running, hiking, doing a marathon, whatever, but something helps. So knowing your family history, eating healthy foods, as I said, the dark leafy greens, and then I'll end with this slide saying that I got involved really in my graduate program doing my doctorate at University of Missouri. Our group has identified actually for the first time in human eyes a specific protein that helps to protect from chemicals, and that can be in the eyes. And we have done quite a lot of research with respect to different types of eye disorders. So currently, I work with mostly dry eyes. A little bit, another group a little bit works on macular degeneration as well, but my main focus is like tear formation, really. And then thank you for listening, and hope this was helpful. And we'll take some questions. Thank you.
Okay, does anybody have a question?
I think we have
Maybe
one
down
here
here.
and
We're
one
going
there.
to use the microphone because that helps the recording pick up your questions.
Okay, I'll try not to speak too loudly in it then. My question is a two-part question.
Sure.
12 years ago, when I was 66, I woke up in the middle of a stroke.
Okay.
And my one main symptom, which alerted me to a problem, were my eyes. They were darting back and forth
Yeah.
very abnormally and difficult to walk.
Sure.
And fortunately, because I've been in healthcare, worked in the healthcare professions, managing medical offices, I was aware, and I got myself to the ER in the appropriate window, and they administered TPA,
Mhm.
which is a drug. I'm not going to go into all that. And I was admitted overnight and no deficits.
That's good.
I've been under the care of a retina specialist now, and I'm getting injections in my eye. But my second part of my question is, lately, now I'm 78. As I'm aging, this one eye that's having problems, I keep having not floaters, but something a little similar to what I had 12 years ago.
Okay.
And I immediately go, oh my goodness gracious, I have to get to that. So, and I've done that twice. Fortunately, no problems. MRI, I didn't have a stroke,
Sure.
but I've had 2 TIAs also before the stroke.
Sure.
So I'm wondering if, as I'm aging, and I know that I'm a candidate for another stroke because of my history, is that a good signal, a good thing am I over focusing because of my history?
Yeah, I think that's a great question, and it's a heavy question too, because I think what you're describing is multifactorial. There are lots of signs and symptoms to look out for stroke, as you pointed out. I would not pinpoint one way or the other. I would say perhaps if your physician actually tells you that these are stuff in your case, knowing your full history, to look out for. I would stick with that. So there may be some things which is minor and doesn't really matter, but there may be certain things which I might say that's minor, but actually knowing your full medical history might be something that to look out for. So I would say that I would definitely take the advice of your physician if you can, and if you think that that's if talk to him or her. Yeah.
Dr. Ray, a question about dry macular degeneration. Is there any cure, any treatment for it? And when you talk about hereditary, my mom had it. Okay. Is there how prevalent is hereditary? How prevalent is it not?
Okay. Good question. So I think from a genetic standpoint, we know that it is linked to a hereditary gene. Not always, but I would say, to just give you some numbers, I would say maybe 20%. Yeah, mostly women. About 20% would be hereditary linked. And you asked the question about dry AMD, which is, by the way, there are two forms of it. One is the wet, that the little puddle of blood I showed you, and the other thing is the white spots. That's dry. Those are called drusen. And about 90% of macular degeneration start off with dry, and they could transform into wet or not become wet. Is there a drug for it? Is there a treatment for it? For dry, not a whole lot. However, there's like one, I think that's in the pipeline of coming out, 1 to 2. A lot of people are treating dry with similar to that of wet and trying to see if that can cure it or not. Yeah, I would say just monitoring at this point would be the best thing. Yeah. And please go to a low vision specialist or a macular degeneration specialist as often they want you to visit. Sure. But limited options for dry.
Hi. Yeah, my question is, I have this dry eye for like several years. So my doctors prescribed me using what is it? Try to remember the name.
Restasis?
The other one,
Eylea, Xiidra.
Xiidra.
Okay.
So I've been using Xiidra for a while. Was there any side effect if you use for a long
No.
period of time? No. Okay, so that's the first question. Second question, because in order for me to correct the vision, I'm thinking about doing the laser later, right?
Yeah.
Would it cause the dry eye even worse?
Yeah, great questions, both of them. So Xiidra is one of the newer ones, I guess. It's good, it's great. If you use it long term, now I think we have data of about 10 years use and nothing has happened. I don't know how long is long term, but it's generally considered very safe. The only common side effects would be probably like itching, maybe watering of the eyes, just like common things, not any related, because a lot of the drug don't get absorbed. So one thing I want everyone to know, eye drop that's given as a drop doesn't really go to blood at all, like very, very, very minuscule amount. So overall, very safe, local action. Second thing, as you pointed out, that yes, so laser surgeries or LASIKs and general surgeries in general have a tendency to cause dry eyes. So what they would do is they would probably give you some steroid eye drops to minimize the inflammation. So the dry eye cause is actually inflammation, so like swelling and stuff inside. So they'll probably try to reduce the swelling. Yeah. So I mean, I would say it's not absolutely uncommon for people who have dry eyes getting LASIK surgery. Yeah, it might cause dry eyes, but if it can be treated as well as it can be maintained, I would say yes, absolutely. Whatever your ophthalmologist, they would know the best. Yes.
I just have a question. If you know anything about red light therapy to help with the eyes, I have macular pucker in one eye and pretty bad floaters, and my doctor had recommended doing some red light therapy to help soften. I cannot say the word with the vitreo.
Yeah,
Yes.
vitreous.
Vitreous, yes. Do you know anything about that? Like if it actually is helpful?
I've heard that it's helpful. I haven't seen much clinical data around it. So it's something that you try, and it has helped a lot of people. So it is probably pretty safe and safe to use if nothing else is changing the floaters. But I don't know for a fact 100% that it's actually clinically shown to be effective.
Thank you.
But yeah, if the doctor says that it doesn't hurt. Yeah, no, there's not a whole lot of adjuvant research around red light therapy.
I'm sorry, I have 4 questions.
Sure.
In the old day, people looked directly to the sun to tell the weather, the time. And now in the new day, we told people that sun's bad for your eyes. So can you clarify that? And you want to visit your eye doctor every year to prevent further problem with eyes, but how come you keep going, your vision keeping stronger and stronger instead of stay the same or less? And not end yet. And what is the most common eyes cancer? And last question, vision memory. So if people have bad vision, is that they're going to have dementia later on in life? If there's vision memory is
Okay, so I'll try to remember all the questions in order. Maybe we can take one question at a time if that's okay. So if I remember correctly, can I have or maybe she can tell me one of the questions. I just don't want to lose the tracks. If you can just tell me the first question back again.
yeah, in the old days.
Okay,
people
directly
look
at the sun. Yeah, so I don't think it's a great idea at all, anyway, to look at. I don't think you can actually look at the sun, to be very frank. It's too bright. You should not be. It'll burn your retina. Even in like cloudy time, you can't look. It's just too bright to look at the sun. So I don't know who would tell the weather by looking at the sun. So if they were doing it, they probably had eye trouble.
I mean, in old days, people.
Therapy once that was recommended to look correct at the sun. Georgia O'Keeffe did that.
Oh.
He developed
Before 10 a.m. and after 6 p.m. Yeah.
Yeah. Well, it's not a good idea. Please, please, please don't. I mean, it's impossible to look at the sun. It's so
Okay,
bright.
second question is, if you go to your doctor often,
Yeah.
then why your strain of glasses getting stronger instead of stay the same? Because
So
that's what.
the doctor really can't change or reverse the eye changes that happen as we age. They just can't. Nobody really can. All they can do is monitor certain things that like, hey, you're not developing advanced disorders. You're not developing glaucoma. So they may be able to track things that are changing, and they can't arrest it. They can't stop this from happening. That's why I'm saying your eyes, your body will just normally, naturally age, all of us, in a certain order. Some different. Like I can tell you that I couldn't see far away when I was in middle school. My mom never had that problem. She can still see pretty good, but at least obviously has reading glasses and stuff like that. She never had that problem. And I'm like, Mom, why do you have such great eyes and I don't? There's no answer to that. I just have that. So I guess.
Looking on the screen. Just kidding. And then common eyes cancers.
Common cancer of the eyes, there are several melanomas type of thing. Probably one of the most common is actually a pediatric cancer called retinoblastoma, which happens in mostly kids. There's really no treatment for it. It's enucleation, taking off the eye is the best treatment available. There are some other smaller type of cancer, but retinoblastoma comes to my mind. There's really no therapy for it. It's just, and the last question.
The last question is memory, vision memory.
Okay.
If people had bad
Yeah.
memory with vision.
Yeah.
I mean,
So
dementia.
as far as I know, that if you have bad vision, your memory is not affected by that. Yes, a lot of your memory is controlled by your vision, but if your vision is poor, your other sensory organs control that memory. So if you have a blind person entirely, their memory is probably going to be smell and touch. So it kind of takes over.
Any last question for Dr. Day? Okay. You're gonna make me work for this one.
I'd like to talk about some good news studies. The good news is that kids can arrest the development of myopia by playing outdoors about 30 minutes a day. And whole nations have arrested the degeneration of their kids' eyes. Japan and Taiwan have arrested the deterioration of their kids' eyes just by playing outside. So can you comment?
So can I comment on this? I think it's great to be more active and have a healthy lifestyle. Kids playing outside, interacting. Maybe they have inside they have more allergies developing and stuff like that. Sensitization happens. If there is a positive correlation, I don't know if I can comment on whether one causes the other. But I think going outside and having an active, maybe that's an active lifestyle, maintaining that's maintaining their vision. Yeah, spending less time in front of a screen and stuff like that. Yeah, for sure. It's beneficial, absolutely. Away from computer, away from cell phones. Just read a book. Hopefully that answers your question.
Thank you, everyone, and thank you, Dr. Day.
Thank you. Bye, everyone.
Just one quick thing.
Go ahead.
Unfortunately, original Medicare does not cover routine vision care. It only covers vision when it's a medical problem. So you have to look into something like an